Good afternoon. Welcome to the press briefing on COVID-19. On stage, we have Dr. Choi Tak-yi, Undersecretary for Food and Health, Principal Medical and Health Officer of the Communicable Disease Branch of the CHP, Dr. Albert Au, as well as Dr. Sarah Ho, Chief Manager from Hospital Authority. Dr. Choi will say a few words. Friends from the media, fellow citizens, last week I announced here that through different service units, the government is going to distribute RAT kits to those who are aged 60 or above. The purpose is to help them to develop a habit of administering RAT on themselves on a regular basis, so that even if they are positive, they can be identified as soon as possible and then be duly treated. Since we start that exercise in Tuesday, the response has been very encouraging, and so far 500,000 of kits have been distributed. Now we have some observations during the past 2 days, and I'd like to explain some of the operational details. Now, to satisfy the demand for RAT kits, we have also already arranged for logistics for replenishment of kits at different places. District health centers, District Health Express, and elderly health centers of the Department of Health have been receiving replenishment today and yesterday, so that they can continue to distribute such kits to the elderly. And venture service units under SWD will be receiving the stock again, and we will be replenishing the stock more frequently in the future. And we've already coordinated with service units. So for elders who are not members of service users of some service units, they can still receive such kits so long as they attend personally these places with a document to prove their age, such as their ID cards, senior citizen cards, or JOU card for verification. That is okay. And these service units include 213 district elderly care centers, neighborhood elderly centers, activity elderly centers under the SWD, the 2 DHCs and 11 DH Expresses, and 14 elderly health centers, as well as 18 tripartite Chinese medicine clinics come centers for training and research. These service units will continue to distribute kits to their members and regular users of their services. We have 213 DECCs, NECs, and EACs in Hong Kong. Most of them are located in public housing estates or housing courts, municipal services, complexes, and shopping malls, and the locations are very accessible. And then for the tripartite Chinese medicine clinics come center for training and research, they are places for treatment. If there are too many people congregated at these places, the normal operation would be impacted on, and that would affect their treatment services. So please go to DCC's units for the elderly enhanced home and care, community care services, integrated home care services, and also those under the private community care services voucher for the elderly to receive these kits. Now, for these recognized service units under the pilot scheme for community care service voucher for the elderly, because of the mode of operation, they can only hand out kits to their service users. To ensure that more elderly persons can have access to such kits, well, the distribution is confined to 5 kits per day per person, and you cannot collect it on behalf of another person. I'd like to reiterate that the purpose of providing free kits to the elderly is, now we're going to do so until the end of May, so there is no need for elders to hold or to receive these kits so quickly. you can go to get these kits when necessary, and please make good use of these resources and apply the test on yourself for self-monitoring of your health. And under the voluntary testing strategy, our community testing centers and mobile testing centers will provide free PCR tests for those who consider themselves of high risk of infection, and our elders, those who are over 60 or above, can also have access to these testing venues. Since the relaxation of the social distancing measure, we can have evening dining-in now, and most scheduled premises are reopened. So please observe good personal hygiene and avoid crowded places of poor ventilation. With gradual relaxation of social distancing measures, the vaccine pass will move on to stage 2 come next Saturday. All persons 18 years or above must have at least 2 doses of vaccines before entering a restaurant or a scheduled premises. And the same applies to those who have received the first dose and aged between 12 and 17. Come end of next month, when the third stage of the vaccine pass starts, or from the 31st of May onwards, save for recovered persons, persons aged 12 or above who must have received the third dose within 6 months after receiving the second dose. May I remind the public that according to experts, there are certain intervals between the first, second, and third doses. Take those who are aged 18 to 59, the interval between the second and third dose of Sinovac and BioNTech should be 90 days. Although there is a sufficient grace period under the vaccine pass, I hope the public will follow the recommendations by the Joint Science Committee of the CHP and receive the vaccines as soon as you're ready. For those who have yet to receive the third dose, and if you're ready for the third dose, please make good use of the remaining 5 weeks before the third stage of the vaccine pass starts and receive the third dose so that you can easily gain access to food establishment and scheduled premises, and also to protect yourselves. Dr. Oh. Members of the public, good afternoon. To report to you the number of cases received by the Department of Health on the 20th of April. There were 317 confirmed cases through PCR, 64 confirmed by HA, 48 by Public Health Laboratory of CHP, and for the remaining 205 from private laboratories. Yesterday, there were 311 positive cases tested through RAT reported to us. So yesterday, we had a total of 628 positive cases. So far, in the fifth wave, Hong Kong has confirmed 1.18 million, 7,003 cases. 743,886 tested positive by PCR, 443,381 through RAT. For cases reported yesterday, 25 were imported, the remaining 603 cases being local cases. For the 25 imported cases, we had 16 found at the temporary specimen collection center at the airport, 9 detected during the quarantine period in quarantine hotels, 2 on day 5 through PCR, and 5 on day 6 through RAT. Among the 25 imported cases, 6 came from Thailand, 4 from the UK, 3 from South Korea, 3 from Pakistan, 3 from Singapore, and 1 from each of the following 6 countries: Australia, US, Malaysia, Canada, and Germany. The Public Health Laboratory did genome analysis on 153 cases, and no L452R positive cases were found, and all were negative to L452R, meaning they were Omicron cases.
As for outbreaks in care homes, we did not record any additional cases for homes which did not have outbreaks before. And for 3 homes, there were previously outbreaks, and we recorded new cases involving 3 residents. And also 3 care homes for the disabled, which had previous outbreaks, and we received new reports involving 6 residents yesterday. As for schools, today, 250 schools resumed classes, including 55 on Hong Kong Island, 93 in Kowloon, and 102 in the New Territories. Most of them being primary schools and international schools. And this morning, all schools have reported to the Centre for Health Protection the RAT results for teaching staff and students. 6 schools reported having positive cases this morning involving teachers and students, namely 7 cases. 5 of them being teaching staff from 4 schools, and 2 being students from 2 schools. As for number of death cases, since the start of the 5th wave, we've recorded 8,999 cases, up by 26 cases compared to yesterday, and the fatality rate at the moment is 0.76%. For cases above the age of 80, the fatality rate is 10.4%. The age profile remains the same, 11 months from 11 months to 112, with median age being 86. For the 3 additional cases recorded yesterday, they were reported by the forensic pathologist of the CHP, involving 2 males and 1 female, aged 72, 83, and 85 respectively. All of them were chronically ill patients, and they passed away on the 10th and the 10th of March, 2nd of April, and 10th of April. And I'd like to speak on the QR code. Since the 19th of April, the government announced that the QR code can be downloaded from 3 systems. First, the electronic COVID-19 electronic vaccination testing record system, www.evt.gov.hk, and the codes can be downloaded via the mobile phones. The second way is I Am Smart, and also the third way, eHealth. And the information includes ID number and the date of testing positive or the date of being discharged from hospital. On the first day, the Centre for Health Protection uploaded all information relating to cases that have been confirmed before the 6th of April. The case number totaled at 1.117298. As for recently confirmed cases within this week, it's possible that they have not yet been deemed recovered. That is 14 days after first being tested positive. The Centre for Health Protection is aware of the citizens' wish to get the QR code for recovered persons as quickly as possible. So for the latest information for cases in the past 2 weeks, the information has been uploaded, and that means 1.187 million cases. Now, today there is media report that close to 400,000 cases, confirmed cases, have not yet been entered into the database, so that no QR code could be issued. That is not true. We have recorded 1.18 million confirmed cases since the 5th wave. And the Centre for Health Protection has always, in a timely manner, put in information regarding these confirmed cases into our system. There is no backlog. And so far, the positive cases have been uploaded to the system, and every day when we receive new positive cases, they will be uploaded to the system in real time. In fact, I've noticed that in the past 2 days, recovered persons have not been able to download their own QR code for recovered persons, and we have followed up on these cases. As we observe that this may be due to a number of reasons. First, these cases may have been reported in the past 2 weeks or verified in the past 2 weeks. We updated the system yesterday, covering all confirmed cases as of yesterday, so these recovered persons can try to download the QR code again today. Second, there are cases not contained in the database that we keep for confirmed cases. For example, if they fail to report to us successfully, or in some cases, the RAT positive cases. The third reason is that when these people try to get the QR code, the particulars they put in do not match the data we have in the database, including the ID number or the date of testing positive. And if they have this record of testing positive issued by the Center for Health Protection, they can check the ID card number and see if there is any error and try again. It could be the case that the month in which the case has been recorded as positive is different from the actual date of specimen collection. It is possible that the date of recovery as recorded falls in the subsequent month. To facilitate the downloading of the recovery record QR code and to address issues, we've set up a hotline, and that is 25695 for members of the public to make inquiries in relation to their recovered record. We have deployed additional manpower to cope with the influx of inquiries. We also allow messages to be left via our hotline. And members of the public can also use the email address ratp.gov.hk to make inquiries. Once we receive emails, we will contact the senders and follow up on their cases. As it takes time to follow up on inquiries, we appeal to the public for their understanding. As announced before, until the 30th of June, that is the end of the transitional period, a recovered person may use a relevant certificate to meet the vaccine pass requirement, including the certificate of discharge from hospital or the SMS record or a paper record of their testing positive by RAT, and also an electronic or paper record of their reporting on the declaration, the isolation order, as well as a certificate of recovery issued by the Center for Health Protection or the hospital authority. Dr. Sarah Ho will now brief you on HKA situation. At the moment, 2,583 patients are receiving treatment at the public hospitals, Northland Town Hong Kong Infection Control Center, HA Infectious Disease Center, and AWE Community Treatment Facility. Six patients were in critical condition, 8 in serious, and 46 patients in serious condition. And so far, 46 patients are receiving treatment in ICU. And over the past 24 hours, 23 persons passed away, and 5 patients passed away, 3 males, 2 females, aged 62 to 102. As for 18 others, there were 11 males, 7 female, from 59 years old to 98. And for the patients passed away, 4 had no vaccination. 9 had no vaccination record, 3 had 1, 6 had 2, and 15 patients were above the age of 65. And for the 59-year-old male, he was a cancer patient. He had 2 types of cancer. One was at its terminal stage, so the patient was terminally ill, and 405 patients were discharged from hospital, 298. In fact, were discharged from hospital upon recovery. And also 2 patients were found to be positive upon the hospital admission screening. There were 4 close contacts identified. And for HA staff, 22,013 staff have been confirmed COVID positive, and 21,091 staff have returned to their positions.
Q&As, please identify the organization you represent and please be succinct. The gentleman on the black, I'm from cable TV. Some contractors have omitted to issue 400-odd SMS, of which 25 were positive. Was CHP aware of their whereabouts, and how come they omitted to issue SMS? It's been We've had a few days of Easter holidays. This is day 1 of the relaxation of social distancing measures. Should there be a rebound, when would that occur or appear? Now, we've got 3 important cases involving. I'd like to know whether there will be flight suspension from these 3 places. I'd like to know whether the students tested positive ever went to school. If so, would suspension of classes be required? Thank you. Regarding the 25 cases, we received notification from the HA. So all these 25 cases were already recorded positive cases in our system. Some of them were positive, tested positive through another test or by their own RAT. So we issued isolation orders to them and quarantine orders to their family members. And for imported cases, some flights had more than 3 cases today, including KE607 from Korean Airlines. Because there was more than 1 case from this flight, and passengers who did not comply with CAP 599H. So under CAP 599H, we've required Korean Airlines to suspend flights from South Korea to Hong Kong starting from the 22nd of April to the 28th of April. As regards cases involving students or schools, we had 7 reports involving schools, 5 teachers or staff members, and 2 students. 5 visited their schools previously, but they tested negative. They tested positive today, and they haven't been to their school since this morning, or they have not returned to their school this morning. We've issued isolation orders and quarantine orders to positive cases and their family members respectively. So according to the isolation order, they are not allowed to go out. The hospital authority has already received a preliminary report from the contractor who omitted to issue SMS to positive cases. We express great regret and disappointment. Earlier on, we issued a warning letter to the relevant contractor asking it to review its full process and to follow up and apologize to members of the public affected. We've urged the contractor to, after investigation, submit a full report and implement improvement measures, and we reserve the right to pursue legal liability. The one in the second last row in red. I'm from Orange News. Good afternoon. I've got a few questions. As mentioned, among the confirmed cases involving schools, I'd like to know whether there are any schools with both confirmed cases among teachers and students? And do you know whether teachers were in contact with students? And what about the risk of passing the virus from teachers to students? We have got 25 imported cases today, rather a relatively high figure. I'd like to know whether all of them were identified or detected at the airport. Have any of them carried mutant variant in Hong Kong? And 405 patients are discharged today. I'd like to know how many of them have been tested after 28 days and then classified as recovered persons. First, on schools. Since resumption of classes, through the Education Bureau, we've required all staff members and students to conduct RET before going to school. This is a risk management measure to avoid cases with high viral load to enter into school campuses. Judging from the number of cases in Hong Kong, now we have about 600 to 700 confirmed cases today, covering different age groups and from all walks of life. And of course, there will be students among them. We expect that some community infected cases might affect our students as well. So the important thing is for all students to administer RETs before going to school. So if positive cases do not go to school, then we can contain the spread in schools. So the number of cases among students is within our expectation. For instance, 250 schools resumed operation today, and we have received 7 cases, none of which has returned to school today. So depending on cases reported to us through schools, the distribution, and we will see whether there are more cases among some schools and whether there is any rising trend. We will monitor the situation. The 7 cases reported to us involved 6 cases, and there is only 1 school with 2 staff members positive. And according to our preliminary investigation, the 2 cases are not linked. So we'll closely monitor the situation. Should there be any abnormal situation, then we will investigate and see whether there is any outbreak in a particular school. The most important thing is for students to observe all protective measures in school and in classrooms. They must wear their masks properly. So should teachers, and they should avoid any mask-off activities. We encourage parents to get their children vaccinated as soon as possible to prevent any infection and serious complications. As for the 25 imported cases, as said, 16 were detected upon arrival at the airport. For the remaining 9 cases, they were all detected during the first 7 days of quarantine. So they were detected under the scheduled testing requirements, and they've all been sent to quarantine hotels. Actually, 290 patients were discharged today. For 107 patients, perhaps due to their underlying diseases or for other treatment, they are still being treated in hospitals. Next. The reporter in a T-shirt on the left-hand side. I'm from AM 730. Regarding the omission to send SMS, there are 25 positive cases affected. What was the expected time for them to receive SMS from the contractor? And what is the time gap between then and the time when they receive an isolation order from the hospital or Department of Health? And as for amendment of the legislation to hand over animals, according to AFCD, well, they will not ask people to surrender their animals and cats, but that for the surrender of hamsters, the arrangement was rather rushed. Do you have any implementation details?
Let me take the second question. The government proposes to amend CAP 599A in relation to the handling of situations in which, if according to the health officer, certain objects are of risk, including animals, and the legislative amendments proposed is based on the hamster cluster that emerged during the COVID-19 pandemic. And in fact, the outbreak was unprecedented. We were the first around the world, and we also had clinical evidence and lab tests showing the risk of animal-to-human transmission and possible outbreaks. So for the sake of public health, the authority should be empowered to confiscate these objects. So the whole CAP 599 legislation relates to COVID-19. The situation may continue to evolve in the future, and there may be scientific evidence showing a real and substantial risk of animal-to-human transmission of virus. And there is all the more reason for the relevant officers to be authorized under the law to take certain action, including the taking and detaining of the animals. And we understand that there are concerns from the public in relation to the treatment of these animals under isolation or quarantine. These are details for implementation. We cannot include all nitty-gritties in the legislation because we have, different animal species and different strains of virus, and by then, within the government, we will consult experts and see how we can continue to improve the handling of this situation, drawing on the experience of the handling of hamsters, so as to reassure the public. So we need time to iron out the details. About the SMS, Dr. Ho, in end February and early March, the patients submitted their specimens. In theory, by early March or mid-March, patients should have had received their reports. So for this contractor, Prenetics, we want to express disappointment and dismay. Next question, this lady on the right-hand side. I'm from News. I have a question. Today, the social distancing measures will be relaxed by phases, and people are going out and about doing exercises and having dinners. Now, will the government step up enforcement? And how to strike a balance between prevention of control and control of disease and relaxing social distancing measures? You can answer in Cantonese. Thank you. I'll try to answer your question. In the fifth wave of the epidemic, there are regulations under CAP 599 stipulating different requirements for, say, catering establishments and pubs. These requirements are put in place to enhance the public's awareness. We appeal to the public for their cooperation, and meanwhile, we also stipulate the relevant penalties for non-compliances. During the long holidays, we've become aware of the fact that some people may now be less vigilant and that we had to step up law enforcement action. So this is already in place. In the current phase, the social distancing measures have been further relaxed, and that some people may be much less vigilant. They may feel quite relaxed. And meanwhile, our law enforcement agencies will continue to monitor the situation and mount enforcement action if necessary, with a view to preventing a rebound of the epidemic. Next question, this one in the shirt. Good afternoon, I'm from Ming Pao. First, on the question of schools, just now you mentioned that a number of teaching staff did go back to school before. So, if I'm not mistaken, what is the CHP's assessment of their getting infected or spreading a virus inside the school campus? And you also mentioned 2 teaching staff from one school have tested positive, but that these 2 cases are not related. Can you further explain your analysis? How do you make sure they have not been infected in the school? And earlier, in a hospital, an instructor was wearing a mask when demonstrating to medical students, and yet the students got infected in the end. And another example, in an examination venue, some students got infected even when they had their mask on. So what is the CHP's assessment on the risk of infected teachers returning to school and infect others? Another question, Dr. Ho Pak Leung from Hong Kong U has commented that the number of COVID-19 oral medication can be used, dispensed, can be used as an indicator of the epidemic situation, and this figure should be published online. Would you consider this expert's recommendation? And also on social distancing measures, in fact, in the past few days, we have all seen crowds in the street, and according to businesses, people have started to make bookings, and some of them even have full bookings during weekends. So are there any indicators based on which we will tighten social distancing measures? Let me speak on the third point about prevention and control measures. Earlier, the chief executive explained that we need to exercise caution when handling the 5th wave. And meanwhile, we consider the number of confirmed cases, the viral load detected in our sewage surveillance effort, as well as the number of or the percentage of positive cases identified in RTD operations and the real-time infection rate, etc. If all of these indicators are on a downward trend, the government will have the confidence that to relax the social distancing measures in the next round. So what is important is that they can be relaxed based on the factors I mentioned, and they will be done in phases. For certain activities to be carried out, depending on, say, the vaccination rate, vaccine pass requirement, and the closure of certain venues. Because in some venues, people may take their mask off whilst chatting, or they may not put on their mask immediately after eating. And these are high-risk premises. And we have the requirement of doing RATs once every 3 days. So if we continue to see a downward trend, we can then strike a balance between the control measures and allowing people to relax a bit. And this is also coupled with the law enforcement action. About schools, after resuming classes, of course, there are more students and teachers gathering in schools, and naturally, the infection risks would be higher. At the moment, we take this risk control approach, and we require all staff and students to undergo RAT on a daily basis before they go back to school. Since they're required to do daily testing, we will be able to identify positive cases and not to allow them to go back to school. And in the community, meanwhile, there are also quite some cases, so the infection risk is to be expected. So if we have positive cases in schools, naturally they may be from students who have been infected in the community. What is important is to prevent these infected students from going back to school so that there won't be further transmission within school. So we introduce the daily RAT, and we rely on schools to report to us on a daily basis the number of teachers and students testing positive. So through tracking and monitoring the data, in the event of an outbreak in school, we should be able to identify as quickly as possible. We rely on daily reporting by schools, and by that we will be able to identify the distribution of cases, whether there is an upward trend and whether there is any concentration of cases, so that we can follow up on it as quickly as possible. Meanwhile, schools should implement control measures. For example, in classrooms and school campuses, they should make sure there is good ventilation, the premises are disinfected, and all teachers and students should wear a mask. And of course, we can't rule out 100% airborne transmission, because after all, Omicron is highly transmissible. So what is important is to do daily RATs. Once there is transmission, it can be detected as quickly as possible. We can prevent infected students from staying in schools.
Speaker is off mic. Because schools only reopened for 2 days, and these two confirmed cases involve teachers. I believe they got infected in the community. We will monitor to see whether we have clusters in schools. So far, we do not see such a trend. So far, schools have only got episodic cases. As at the 20th of April, public hospitals has already prescribed new oral drugs on 27,300 patients. We have got various monitoring measures. Of course, we will humbly consider views from experts and consider them. Next, I'm from HAET. For prenetics, 25 cases did not receive SMS. Can you tell us when samples were taken for them? Theoretically speaking, they should have received the positive notification SMS in mid-March. I'd like to know when did they actually received the result, and when did HA receive notification? How come it was only announced by the contractor yesterday? According to HA, a warning letter has been issued. I'd like to know what deterrent effect it serves. For instance, will the contractor be dismissed after a certain number of warning letters have been issued? And now for schools, among the 7 cases, have 5 of them been to schools for how many days? And as for death cases, can you give us details on the case involving the 59-year-old male? For instance, when was he confirmed? In end March or late March, we received complaints from patients. So at once, we contacted the contractor, asking it to review the situation. And we've just received the preliminary report from the contractor in question. So we are extremely disappointed and express regret for this incident. We've issued a warning letter to the contractor asking it to review its work processes and to follow up and apologize with the patients involved. We've also asked the contractor to announce the incident, and that's why you have seen this statement from the contractor, and we've urged the contractor to submit a detailed report after investigation and to implement improvement measures. We reserve the right to pursue responsibility. Those patients were tested in between the 21st of February and the 1st of March. For cases in schools, we have received 7 reports from schools. All of them tested negative previously. 5 never attended school, and 2 returned to schools after class resumption, but they tested negative before returning to schools because they are required to do an RAT before going to school. And this morning, they tested positive through RAT, and they have not attended school as a result. We'll monitor the situation to see if there are more cases from these schools. If so, there may be a risk, but so far we haven't seen such a trend, but we'll closely monitor the situation. We received notification from HA in April of the incident, so we double-checked these cases to see whether they were reported to us previously, and they were all found in our earlier reporting system. Perhaps or they were reported through other channels, or they might have reported their own cases to us through our AT, and SMS has been issued by us to them. Speakers off mic. I don't have information on that. Next question. The 59-year-old, a death case. The 59-year-old male patient had liver cancer, and recently he was found to have a cancer in his pancreas and also at a terminal stage. His condition deteriorated upon admission, and he also tested positive for COVID-19. He was a high-risk patient back then, and his condition continued to deteriorate until he passed away. An English question, please. The gentleman in grey.
South China Morning Post. So will classes be suspended over the upper respiratory tract infections like before? Because we saw last year there were such class suspensions as well. If so, are the criteria still the same? Have there ever been any changes for such class suspension after DH announced the 5% rule for COVID infections? And now that people can report their previous infections to the health authorities via the hotline and the email, so how do the health authorities deal with these backlogged cases? Are they in the same statistic pools as those reporting within 24 hours? And also, is the form given via the is that form no longer valid after the 30th of June? And then the health authorities yesterday appealed the next of kin to claim the bodies of their deceased family members. So why is there such sudden policy change given, there were so many backlash about claiming bodies previously. Is the situation about, storing those bodies got improved recently?
So perhaps Dr. Au can have to answer these questions. Dr. Au, please.
For the cases in the school, as the Department of Health has requested all students and staff of the schools to perform rapid antigen tests before going to schools every day. If they are tested positive, then they should remain in home and should not attend school. So this is a risk management measures to decrease the risk of transmission in schools. The Center for Health Protection will closely monitor the number of positive cases reported to the schools by the students and staff every day and monitor the situation to see if there is any outbreak or transmission inside the schools. Normally, at the current level of the epidemic, it is foreseen that there will be cases affecting students and also staff in the communities, as they are members of the community, so they might acquire the infection in the community. The most important thing is that they should have a rapid antigen test every day, so that if they are tested positive, then they do not attend the schools and decrease the risk of any transmission inside the schools. If we detect any increase in or upsurge in cases, we will liaise with the schools to perform some investigation to see if there is any outbreak. If the number of cases exceed the expected level, for example, over 5% of the students or staff in the schools were tested positive on a single day, then we will carry out some epidemiological investigations to see if the school require any further or enhanced measures to control the transmission, including class suspension. But there is no any hard and fast threshold for class suspension. We will investigate every single outbreak individually to determine the appropriate measures. And for other respiratory diseases, the schools should also report to us if they notice any upsurge or increase in absenteeism or students with upper respiratory tract infections, so that we can also carry out investigations to see if they require any enhanced measures. For the second question on the retrospective reporting of RAT cases, we encourage the citizens to report their positive RAT results immediately to the Center of Health Protection, normally within the same day or on the next day, so that we can issue isolation order to them and also implement necessary control measures. And also this allows us to monitor the disease trends in a timely manner. For those cases with special reasons who could not be reported to the Department of Health through the online platform, they can dial our hotline or they can send an email to us so that we can obtain their information first, and then to understand the reasons why they could not be reported to us in a timely manner. If their reason is acceptable and we verify that their RAT is a true positive, then we might consider to issue back some isolation record to them and also include them in our confirmed case database. But however, these retrospective cases or backlog cases will not be included in the daily number of new cases, as they are not new cases and they are retrospective cases.
And about the claiming of the bodies by the family members?
For the last questions, in view of the larger number of deaths occurring in A&E and of public hospitals within a short time from late February to early March, the Department of Health has already adopted a special arrangement from March to early April with support from the police, under which the identification procedures of some 1,800 bodies were completed, and all with certificate of order authorizing burial cremation of body issued by the coroner. As of today, about 1,100 bodies are still stored at DH facilities after completion of the relevant procedures. So the Department of Health appealed to the next of kin to claim that the bodies of their deceased family members to make funeral arrangements as soon as possible.
好，我哋問埋嗰邊仲有一個題目。
Last question over there, right-hand side. I'm from Now TV. The vaccination rate for the first dose has reached 90%, and some citizens have appealed to the government to reopen sports centers. The sports centers at the moment are used as vaccination centers. Do you think there is room to reopen them as sports venues? And for vaccine pass, at the end of next month, it will move to the third phase. But there is no concrete date for the next jab and on the next round of relaxation of social distancing measures. When will it be, so that will the government inform us so that we can be prepared? And the DSE exams will begin tomorrow. And we noticed that there are some cases involving DSE students. So what is your assessment on the risk of infection among the DSE students? Do you think that it is of a high risk? And for close contacts, the DSE students as close contacts will be sent to Penny's Bay for the purpose of quarantine. How many medical staff do you have there? And will you increase healthcare manpower in light of the DSE exams? Regarding sports facilities, at the moment, some of them are converted into facilities for vaccination or for other prevention and control functions. And I believe that the government has taken into account different factors. For some indoor venues, they may be more suitable for other anti-epidemic purposes, and they will be released and converted back into sports facilities when appropriate. As for the vaccine pass, I think this is not the same consideration as the other requirement, because vaccination could help minimize severe cases and infections. However, whether social distancing measures should be further relaxed depends on the epidemic situation. We need to observe further. This is just the beginning of the relaxation of measures. I implore the public to remain vigilant, not to be too relaxed, as we don't want a rebound. And if we are successful in the sense that there is no rebound, I think the government will be confident in proposing the next round of relaxation. Penny's Bay, I don't have information about resident healthcare staff there. As for infection risk, as Dr. Au just now put it, before going back to school campuses or examination venues, students are subject to daily RATs. So the infection risk should not be brought to the school campuses or examination venues. Earlier, the Education Bureau and the HKEAA announced that if a DSE student is found to be a confirmed case or a close contact or a household contact, some arrangements will be put in place. We encourage students to take RATs on a daily basis. For students testing positive, we, according to the procedure, will issue the isolation order. As announced by the HKEAA, if the DSE student as a confirmed case is willing, the student can go to Penny's Bay to continue to take the examination under isolation. They can ring this number and apply, and the phone number is 36288860. And I believe that once these cases for assistance have been received, arrangements will be made for students to take the exam in Penny's Bay as quickly as possible. So once a student tests positive, he should contact the HKEAA. If they wish, they should take the exam in Penny's Bay. And if they exhibit any symptoms, they should not go to the examination venue. If the case is found positive in the morning between 6 and 6:30, they can contact the HKEAA Information Center and also contact the anti-epidemic taxi fleet to reach the Penny's Bay Examination Center. That's the end of today's briefing. Thank you.